Izzy, okay? Izzy? There are a few simple but critical steps that have to be followed in order to intervene successfully when someone is choking. First, what is choking? Choking occurs when food, which is intended for the esophagus or the food pipe, inadvertently becomes lodged in the trachea or the windpipe. In adults, choking episodes occur mostly while eating. Choking is never anticipated. There are no early warning signs when someone is choking. It is up to you to recognize them and act decisively and quickly. Without intervention, the result is death. Choking victims cannot call out for help or scream. Oftentimes, the only sign that a person is choking is the universal sign of choking, universal sign of distress. They're trying to say help, but they can't. If you witness someone in distress, you must know what to do, and you must do so without hesitation. Intervention. First, face the victim. Look at him or her and ask them, "Are you choking?" Ask someone to call 911. Encourage them to cough vigorously. Stay with them until the object is expelled. If the person can no longer speak or has a high, ineffectual type of crow or cough, then tell them that you are trained, you know the Heimlich maneuver, you will be working to expel the object. You will position yourself behind the victim, ready to act. Once you are behind the victim, come up close to him and wrap your arms around him. Bring your hands to his waist and approximate the area to be at his navel. Press inward and upward in sharp jabs or thrusts in order to compress the abdomen up into the lungs. This will create pressure in the lungs and hopefully push the object out of the throat by the force of the stomach being compressed. If the object cannot become dislodged, in time the victim will become unconscious. If that is the case, gently lower the victim to the ground, attempting to protect the victim's head. What do we do for an unconscious victim of choking? Open the victim's mouth, look in and attempt to remove the obstruction by sweeping your fingers in and around the mouth. The act of becoming unconscious or falling to the floor may have dislodged the object. Whether you pull something out or not, the obstruction may still be there. Even if not, the person may now require that you breathe for them. Position the patient on his back with his head tilted back. Press down on his forehead with one hand, and with your other hand, lift the side of his chin upward. Hopefully, this will enable air to pass directly into the trachea or the windpipe. Put your mouth over his mouth. Pinch his nose shut with one hand and blow into the victim while maintaining a tight seal around his mouth. If the air does pass in, watch for the chest to rise. If it does not, reposition the head using the same technique and try again. If your breath does not go in, straddle the victim's knees and place the open palm of one hand below his navel. Place the other hand atop this one and press simultaneously in an inward and upward motion 5 times. When done, go back to the head as before to check if the object has been expelled. By opening the mouth and sweeping your finger inside, position the head again and attempt to breathe. Then follow up with abdominal thrusts. Continue this sequence by opening the victim's airway, attempting to breathe for him, and doing abdominal thrusts until the object is expelled or professional help arrives. Unlike adults, infants and toddlers can and do choke on items other than food as well. Small toys, anything that they can take and put into their mouths. Therefore, it is crucial to remember that any time an infant is found that may not be breathing, we should worry about, check, and assess and intervene for possibly choking. Remember also that an infant that chokes is not going to be able to cry. The arms may be flailing as though the child is in distress. The infant is trying to signal that he's helpless and that something is wrong, but no sound comes out of its mouth. The color. The color may be blanched and subsequently become a darker hue, such as a dark red. All this is due to the fact that the child is not having any oxygen going into its lungs at this time. Remember, the throat of an infant or toddler is anatomically or physically different than an adult, and therefore so is the technique for dislodging an object. Carefully lay the child down on its belly so that the child's head is lower than its torso. Once in position, take your other hand, position it between the shoulder blades of the infant, and quickly administer 5 back blows. Next, take that same hand that you used to administer the back blows, place it over the back and the head, and turn the child. Using your other hand, place 2 fingers on the mid-chest of the child, on the breastbone in between the nipple line, and press 5 times hard on the chest of the infant. Repeat this, the back blows, the chest thrusts, until the object is dislodged or the infant goes slack and becomes unconscious in your arms. Now with the infant unconscious, how do we intervene in order to remove this object? Lay the infant down first on a hard surface on its back. Quickly make an assessment to see if the act of becoming unconscious itself may have dislodged the object. Look into the mouth, opening it carefully. If you see the foreign object, put 1 small finger in and attempt to remove it. If you do not see the obstruction, do not put your finger in. On an infant, unlike an adult, the airway is opened by pressing slightly on the forehead, merely to align the head with the body. Excessive motion will close the airway. So what we're going to do is we're going to open the airway by pressing slightly to place the child in a neutral position. Next, place your mouth over the nose and the mouth of the infant and breathe a cheekful of air into the infant while watching and assessing for chest rise. If the second breath still does not go in, align one arm as before, positioning 2 fingers over the child's chin to maintain an open airway. Lift the infant up, turn the infant over, placing him in a downward motion, and administer 5 back blows. If the infant is not breathing, fall into the sequence of administering 5 back blows and 5 chest thrusts and attempting to breathe again. Remember, even if your technique is not perfect, do something. Intervene. Don't watch. The alternative is certain death. The reenactment that you've just seen of a choking episode and its intervention is not intended to take the place of formalized education. That can only be done by taking a formal CPR, foreign body airway obstruction course. The intent of this film is to dramatize the need for such a course and to give you a hint of how to intervene in the event of an emergency.